Upper back pain, also known as mid-back pain, is common among athletes and those involved in weight training. Weightlifters and gym goers can experience upper back pain during bench press, pull-ups, deadlifts, and cable rows. It's something I struggled with. It is frustrating, painful, and demoralizing. I fixed my upper back pain and I will show you how to do the same. Hello, this is Nuruddin. In this video, I will show you step by step how to get rid of upper back pain so you can lift and work out without pain in your upper back. For reference, here's a timestamp of this video. This is a two-part video. In this explainer video, you will learn everything you need to know about upper back pain, what causes it, why it happens, and the fastest way to fix it. The second video is a 5 to 10 minute treatment video where I show you step-by-step exercises to treat and get rid of upper back pain. Before we begin, a quick medical disclaimer. I'm a personal trainer, nutritionist, physique athlete, and wellness coach. I've been lifting for 10 years. I transformed my body, but in the process, I experienced and struggled with several weightlifting injuries, including muscle injury pain and tendonitis. I was frustrated and fed up with the generic advice I was receiving from professionals I consulted with, such as ice and rest it, painkillers, and physical therapy. So I set out to solve this issue for myself. What I discovered worked so well for me, I've synthesized everything I've learned in over 5 years of research on this topic, and that's what I will be sharing with you. So this video is for informational purposes only. It is not medical advice. Upper back pain can be a sign of a serious medical condition. It's always a good idea to consult with your doctor to make sure there is no structural damage to the spine. With that said, let's begin. What causes upper back pain when lifting weights? The root causes of upper back pain are muscle restriction, subluxation, and chronic inflammation. Muscle restriction. When you lift weights and perform exercises that target or involve the back, the upper back muscles, specifically the trapezius, rhomboids, serratus posterior, and erector muscles, contract, become stiff and tight, and after some time lose their elasticity. Muscle restriction occurs when inelastic muscle fibers become shortened and unable to release and lengthen back to their normal relaxed state. In the case of upper back pain, lifting a weight that is too heavy or using bad weightlifting form overstretch and cause the muscles in the upper back to become restricted. This is usually the trigger that initiates upper back pain. When the trapezius, rhomboids, serratus posterior, and erector muscles in the upper back get restricted, they become shortened and get tighter, which leads to pain in the upper back. Additionally, tight upper back muscles pull and put tension on the thoracic spine. Over time, this can cause a condition known as subluxation. Subluxation. Restricted muscles generally pull tighter on the joints. Over time, this causes the joints to move out of their normal position. This condition is known as subluxation, and it can affect the joints and nervous system in the body. In the case of upper back pain, restricted muscles in the upper back pull on the vertebrae in the thoracic spine. Over time, this causes the vertebrae to move out of their normal position, which causes pain. Misaligned thoracic vertebrae also stretch and choke the nerves, leading to sharp nerve pain in the back. Finally, misaligned vertebrae inflame ligaments and spinal disc in the upper back, which creates excessive inflammation in the thoracic spine that leads to more pain. When the upper back injury continues for 3 months, it becomes a chronic inflammatory condition or chronic upper back pain, chronic inflammation. So far, we've discussed how muscle restriction and subluxation cause inflammation of muscles, vertebrae, and spinal disc in the upper back. When the injury first occurs, the inflammation is acute, meaning the pain and condition are temporary. With time, the body heals injured muscles, tendons, and ligaments in the upper back, and the pain goes away. However, when restricted muscles and subluxation in the upper back cannot heal and recover, and the pain continues for 3 months or more, it becomes a chronic inflammatory condition. Chronic inflammation is a state where the inflammatory process that enables the body to heal injured muscle, tendon, and ligament is not working, and the body is no longer able to heal on its own. In this case, it leads to chronic upper back pain. Left untreated, chronic inflammation in the spine becomes degenerative and leads to irreversible deterioration of the spine. To summarize, the causes of upper back pain when lifting weights or during exercise are: 1. Muscle pain caused by tense and restricted upper back muscles. 2. Subluxation caused by tight muscles that pull on the thoracic vertebrae, moving them out of their normal position. 3. Inflammatory pain caused by strain and inflammation of the muscles, ligaments, and vertebrae in the upper back. Overview: 3 steps to fix upper back pain. To fix upper back pain, we need to do 3 things. 1. Reduce chronic inflammation to heal muscle strain, inflame tendons and ligaments causing pain in the upper back. 2. Fix subluxation in the thoracic spine to correct misaligned vertebrae and release pressure on the spinal disc and nerves. If a person experiences a sharp pain in the upper or mid back, this will help fix it. 3. Release restricted upper back muscles to improve muscle pliability. If a person experiences dull pain in the upper or mid back, this will help fix it. It's that simple. If a person does these 3 steps, they can fix and eliminate upper back pain. I cover how to reduce chronic inflammation using a plant-based diet and magnesium therapy in the TitaniumPhysique Step 1 and Step 3 videos. So in the rest of this video, I'll focus on how to release restricted upper back muscles and the best way to fix subluxation in the upper back. Types of upper back pain conditions and how to fix it. There are 2 types of upper back pain condition people experience when lifting weight or during exercise. The first type is pain between the shoulder blades, also known as scapular. The second type is sharp pain along the spine near the midsection of the back. To fix and get rid of pain between the shoulder blades, we need to target and release the trapezius, rhomboids, and erector muscles. The rhomboids are one of the primary muscles that stabilize the scapular and help bring the shoulder blades together. When the rhomboids get restricted, it causes pain between the shoulder blades. Next is sharp pain along the spine near the upper or mid section of the back. This is caused by a combination of muscle restriction and subluxation. Here's what happens. Chronically restricted upper back muscles get overstretched. As a result, they pull on the thoracic vertebrae, leading to sharp pain in the upper back. If the pain is sharp and it restricts your mobility, the first thing to do is find a chiropractor to adjust and correct any subluxation. You can find a local chiropractor in your area by searching on your favorite search engine. I prefer Gonstead chiropractors. I like their approach to spine health, and I've had great results with their approach. From my experience with Gonstead chiropractors, first, they do an x-ray of your spine. Next, they use a special tool to read the nerve endings along the spine to find subluxation. Then they adjust that specific vertebra. Whichever chiropractor you choose, I suggest the type that would first do an x-ray of your spine, if possible, before any adjustments. In my experience, this initial analysis can help prevent further complications. Most people will need 2 to 3 chiropractic adjustments to correct and fix subluxation, but this depends on your specific situation. The chiropractor can help you determine how often you need to get adjusted based on their assessments. Once the sharp pain in the upper back is gone and you can move freely without sharp pain in your back, you can begin releasing the upper back muscles to prevent future relapse of subluxation in the upper back. Releasing the muscles of the upper back is simple to do. The good thing is you can do it all in the comfort of your home. I've got a video that will show you step by step how to do it. We'll discuss that video in just a moment. In this part of the video, I'd like to discuss the best method to release the collective group of muscles we just discussed. This group of muscles include the trapezius, rhomboids, serratus posterior, and spinal erectors. There are 3 general options to release this muscles: massage therapy or other forms of manual therapy, vibrating massagers, and physical therapy, which includes stretching and mobility. Massage therapy. Massage therapy is effective for treating pain caused by injured muscles and tendons, such as upper back pain. However, it's necessary to get multiple massage treatments over an extended time, which can be expensive, making this solution impractical for most people. In addition, most people don't like the intense pain during a therapeutic deep tissue massage. Some people tense up during this type of treatment, which makes it counterproductive. Ultimately, the main reason I do not recommend massage therapy or other forms of manual therapy is to fix chronic upper back pain as well as counteract and prevent upper back pain. It's necessary to treat the upper back muscles often. So unless someone has the resources to see a manual therapist 2 to 3 times a week indefinitely, this solution is not sustainable. Vibrating massagers. When you apply vigorous vibration to a chronically stiff and tight muscle, it can trigger the muscle to tense up and get tighter. This is because the muscle is inelastic and cannot absorb the shock of the vibration. Most people find that their muscles get tense and tighter after using a vibrating massager. For this reason, I don't use vibrating massagers and do not recommend them when treating chronically tight muscles. Physical therapy, stretching, and mobility. Stretching will help lengthen a muscle and it helps reduce muscle pain and joint pain. However, stretching a chronically tight muscle will not lengthen the muscle and alleviate pain. Before you can lengthen the muscle, first it is necessary to release the restricted muscle. Then you can stretch the muscle to lengthen it and alleviate pain. So physical therapy, including stretching and mobility, are important, but they are not the solution. So what is the best method? Self-myofascial release tools. Self-myofascial release tools, aka SMR tools. The fastest and easiest way to release restricted muscles and fix upper back pain is to use myofascial release tools. Here are 4 reasons why I use and recommend them. 1, they are generally inexpensive, so cost is not an issue. 2, they are effective with trigger point therapy. Trigger points are specific areas in the body where muscle often become knotted and cause pain. I will show you how to easily identify those muscles, and because you know and can feel exactly where the pain is in your upper back, you can easily target those trigger points yourself. 3, you can use these tools in the comfort of your home as many times as needed. Additionally, these tools are durable and last many years, so it's a sustainable solution. Finally, because you'll be performing the treatment yourself, you can control the pressure. As such, the body can remain relaxed throughout the treatment for better and faster results. Here's a quick summary. To fix upper back pain, we need to release restricted muscles in the upper back. The 3 common treatment options are massage therapy, vibrating massages, and physical therapy, which includes stretching and mobility. However, these options are ineffective or unsustainable. The best method and the fastest way to release restricted upper back muscles is to use self-myofascial release tools. Upper back pain SMR treatment video. I've created a simple to follow SMR treatment video for upper back pain. Myofascial release is a safe and effective technique that involves applying gentle, sustained pressure to a restricted muscle or trigger point to eliminate pain and restore motion. The upper back SMR video is a 5 to 10 minute treatment routine where I show you step-by-step exercises to treat and fix upper back pain. You can use this treatment routine either at the gym or in the comfort of your home. You will need some SMR tools, specifically a Body Star massage ball, acute mobility roller, and Physiorite. It's important to use the right tools to get results. If a person uses the wrong tools, the results are going to be frustrating and demoralizing. I've tested a lot of these tools to find the best and most effective ones. So if you don't already have these specific tools, make sure to grab them so you'll have them when you're ready to get started. You can find a link to these tools in the menu section of the members dashboard or mobile app. Upper back pain treatment versus prevention. In this part of the video, I'd like to discuss the difference between treatment versus prevention for upper back pain. To treat and prevent upper back pain, we must do two things. 1, keep the spine healthy, and 2, keep the upper back muscles pliable. First, let's discuss the muscles, then we'll talk about the spine. The treatment routine we'll be using to fix upper back pain is the same routine we'll use to prevent upper back pain from coming back. The difference between treatment and prevention is how often we apply the routine. For example, to treat chronic upper back pain, we need to work on the upper back muscles every other day. 1 day treatment and the next day rest to allow the muscles to recover. For faster results, you can work on the upper back muscles 2 times a day, once in the morning and then once at night. You want to get to the point where the upper back muscles don't feel tender during treatment. Muscle tenderness is pain or discomfort when pressure is applied to the affected muscle. Once the tender feeling in the upper back muscles is gone or significantly reduced, you have effectively released the restricted muscles causing pain. From there, we want to maintain the new level of muscle elasticity to prevent the muscles from getting restricted again. For prevention, use the same routine in the treatment video 2 to 3 times a week to counteract and prevent upper back pain. Keep in mind, the more you train and the heavier you lift, the more often you'll have to apply this routine to keep the upper back muscles pliable and healthy. Now let's discuss spine health treatment versus prevention. As I mentioned earlier, if you experience sharp pain and it restricts your movement, the first thing to do is to find a chiropractor to adjust and correct subluxation in the upper back. To correct and fix acute subluxation, most people will need 2 to 3 chiropractic adjustments, but this depends on your specific situation. Your chiropractor can help you determine how often you need to get adjusted based on their assessments. For prevention, a good way to think about it is the body is always in a state of change. It is either anabolic or catabolic. Anabolic means it's improving and getting better. Catabolic means it's breaking down due to stress, pressure, and lifestyle factors. To keep the spine healthy and prevent upper back pain, it's important to have regular checkups with your chiropractor. I see my chiropractor once a month for routine spinal adjustments. In addition to applying the routine in the upper back treatment video, monthly checkups with your chiropractor will help you counteract and prevent upper back pain. One final point to keep in mind: muscles support and stabilize the joints. When muscles become tight, the joints adapt to the tightness of the muscle to maintain stability. Likewise, when the muscles become more pliable and elastic, the joints must readjust to the new elasticity of the muscles. This means when you start applying the routine in the treatment video and the upper back muscles begin to release, the thoracic spine will need to get used to the increased range of motion in the upper back. One way to help the thoracic spine adapt faster is to perform upper back mobility exercises. Mobility exercises improve range of motion, joint stability, and muscle strength by controlling the muscles around the joints. In addition to the upper back treatment video, I've created a simple to follow upper back mobility exercise video in a series called Power Strength Mobility. It's a 5 to 10 minute video. To summarize, you can use the SMR routine in the upper back treatment video every other day to treat and fix upper back pain. On the days where you're not using the treatment routine, you can use the upper back power strength mobility routine to strengthen and stabilize the upper back for faster recovery. When you get to the prevention phase where your upper back feels great and you can lift and work out without upper back pain, use the SMR routine 2 to 3 times a week to keep the upper back muscles pliable and healthy going forward. During the prevention phase, you can also use the upper back SMR routine the night before any upper body workouts. It's also beneficial to use the upper back SMR routine after your upper body workouts, ideally 2 to 3 hours after the workout. This practice will help the upper back muscles recover faster for the next workout. We've covered a lot of information in this video. If any of this is new, some of it might sound confusing, like it was for me when I first started to learn some of this. If that's the case, I encourage you to go back and listen to this video or the audio program as many times as necessary. That way you will have the foundational information necessary to fix and counteract upper back pain. Once I understood this information and implemented it into my fitness routine, it allowed me to eliminate and counteract upper back pain. I lift heavier and my body recovers faster from acute upper back injuries. Getting started. To get started, check out the upper back treatment video in the TitaniumPhysique members dashboard or mobile app. Thanks, and I look forward to seeing you in the next video.